Now, you've heard me say more than once in my prior videos that physical therapy is largely becoming a joke in many instances. And I always say it's not all of you, but it's definitely becoming most of you, especially in the outpatient. You're even starting to see it on the YouTube, the blogs, and other forms of social media under topics of physical therapy is really just a waste of time. Is physical therapy really necessary? Former patients are starting to comment all the time that, yeah, I was in the clinic, basically just did everything on my own. Thanks so much for charging my insurance company a couple $100 for what was largely just limited supervision and a workout. But it's really funny because when I run into other travel physical therapists who spend most of their time seeing multiple patients at a time, when they come to our clinic and I watch them work, they're largely just reiterating the fact to me that our profession has been seriously downgraded in terms of skill set. And I'm going to tell you why in all the genres, one by one. First of all, let's look at outpatient. Say you have a 45-minute session. What does the average physical therapist do? He puts them on the new step or UBE for 10 or 15 minutes. I addressed this before in another video. Why? What are you exactly hoping to accomplish with this? They're not a cardio patient and it's not really giving a cardio effect. Has nothing to do with any corrective exercise that may help them. And of course, a physical therapist will say, well, it's a warm-up. Not for 10 or 15 minutes. That's ridiculous. The only time that wouldn't be ridiculous is if it's a hip or knee replacement. That I understand. But the problem is it becomes standard for every single patient that comes in. Warm up on the UBE, warm up on the new step. And the reason they do that is because they're used to clinics where they see multiple patients at a time. Me, I don't have 15 minutes to burn with what I'm doing for a patient because I'm doing a lot of manual therapy. But then, after that extensive warm-up, which really accomplishes nothing except charging 1 unit of Therex, you basically have the patients just run through their exercises. Now, I know what the commenters are going to say. Well, we need to observe these so we can make adjustments to the exercise. First of all, rarely are you ever actually making adjustments. You're running them through the same exercises every session. Most of the time. Secondly, if it's a matter of you being there watching them to see if you need to do adjustments to exercises, why are you seeing them twice a week? Once a week would suffice at most. Because the fact is, most of these patients could do this at home if this is all you're doing. Again, not including hip, knee replacements, shoulder surgeries, etc. But for all the other regular type diagnoses, especially those of just general pain in some certain area of their body, they don't need to come in and just go through their exercises while you watch. I mean, I really think, is this what our profession has been downgraded to? Because basically, you're just a glorified athletic trainer. Now let me tell you 2 philosophies of therapists who are working one-on-one who are not operating in this manner. One of them is the manual type therapist, and it doesn't matter what you've been trained in, Maitland, Mulligan, some people use Barnes, many use a combination of all of them. Because after you've been around a few years, you realize that what works for one may not work for another, and many times combinations of philosophies work the best. When I have a patient for 45 minutes to an hour, I'm spending probably 2/3 to 3/4 of that time doing manual therapy. I go over their home exercises a few times to make sure they have it right. Then after that, I largely don't touch them again. Or sometimes I'll have them go through for 10 minutes to reinforce what I just did manually. And the research is back and forth whether this is actually having a cement effect or not. But most of the time, I'm using these. But let's take the therapist who's highly trained in Sarman technique. If you look up the videos of some of these Sarman-trained therapists, they are spending a great deal of time analyzing posture, analyzing movement, and giving very specific exercises that will correct these deficiencies in posture and movement, many times which are related to their work activities. And they're also using manual therapy too. If you look up Jared Vagi's series of corrective exercises, you will see him use mobilizations and self-mobilizations for the patient's self-use at home in conjunction with these corrective exercises. But what he's not doing is just having the patient come in, get on the new step, and go through their basic exercises that are given for the same diagnosis with every patient walking in the door. Because if you're going to do that, you really need to downgrade the frequency of how many times they come to the clinic. And for the argument, well, they won't do their exercises at home, so they have to do them here. Well, then they won't get better, period. They're not going to do their exercises once you discharge them. So you're wasting your time anyway, and you should have figured that out early in the treatment sessions. So that's why the outpatient has become such a dumbed down skill set in our profession, because we've had a whole generation of physical therapists who allowed it to happen, basically because they were seeing overlapping patients. And then when they finally get to actually treat one-on-one, they really don't know what to do outside of watching them do their exercises. But let's look at another genre. Let's take the hospitals. I used to work the hospitals. Matter of fact, I started off in hospitals and skilled nursing and stayed there for a few years. But many of the hospital patients, the doctors write the order just thinking the therapist should just be walking them in the hall every single session. That is not the proper use of physical therapy. But therapists go along with it because they're afraid of offending the almighty doctor. You can find out during the evaluation, okay, they're capable of walking 300 feet, you discharge them to nurses. But you would not believe the amount of patients I've seen back when I worked in the hospitals where the therapist just walks them up and down the hall and that's the entire treatment. Another example of our profession just being dumbed down, and another example of physical therapists just going along with it. Now, if you look at the skilled nursing facilities, back in my day, they had the rug system, so everybody was dovetailing, in other words, seeing multiple patients at a time. It was incredible because when I was working as a home health therapist back in the early 2000s, we would get a patient who would come out of one of these California skilled nursing facilities post-CVA. They were discharged without even the ability to stand well for 30 seconds, but yet they started walking with me a few weeks later, maybe not walking well, but at least taking steps and advancing because I was the first person who worked with them one-on-one. And it wasn't just one patient this happened to, it was rampant. And I know it was rampant because I lost more than one contract because I wouldn't dovetail in these skilled nursing facilities. After the interviewing director lied to me about how they were operating, which was most of the places, and then I'd lose the contract. After battling in that arena for a few years, I finally dropped skilled nursing in 2009. But think about the level of skill these therapists were accumulating over the years. They're basically sitting watching a group while they're taking notes. And you wonder why I'm saying the physical therapy profession is becoming a joke? Well, look at you. As I said before, these videos are largely for the new graduates because I hope they undo what my profession did. Because I know I'm not going to change the senior therapists who've been operating corruptly their entire careers. It is too painful for these senior therapists to look in the mirror and realize they've been a joke the majority of the career that they chose long ago. And I'm advocating to the new graduates, you take on these senior therapists. Just because they've been there many more years than you doesn't mean they've been doing it right. The physical therapist should know how to use these. And as you advance, you're going to know how to use these and corrective exercises in combination, and you're going to know a few philosophies of these. That's what you should be spending your time doing. That is what a physical therapist was meant to be. It is amazing when I talk to senior therapists who have been operating ethically their entire careers. We just marvel how these travel therapists come to the clinic and after about 25 minutes they run out of stuff to do because they don't know anything else. And these are travel therapists with years of experience. They end up spending the entire session just basically doing different versions of the same exercises just to fill the entire amount of time with the patient. So to the new therapists out there, learn your manual, learn corrective exercises with people like Sarman, go out there, practice ethically, one-on-one with patients, and undo all this damage that my generation of physical therapists caused.